Some foods that help support lactation, there's a lot of foods, and it could be depending upon what culture, what your backgrounds are. But some common things that are talked about are oatmeal, lactation cookies, acai berries, other berries, citrus fruits, vitamin A rich foods. There is a website that you can go to called lowmilksupply.org if you're, concerned about your milk supply, wanting to increase your milk supply for whatever you're needing it for. If you're, just having low milk supply, you can go to this website and they have different, what we call galactagogues, milk inducing herbs and teas and things like that. I definitely encourage you that when you go to that website, if there's something you're interested in, that you definitely want to talk to your primary care provider or your OBGYN before taking anything, just to make sure that it's okay for you to take. Because there are some things on there that, like fenugreek, that you may not want to take without consulting a physician first. So these suggestions work for some people and not others. So just because it works for a friend of yours, it doesn't mean it's going to work for you. And so you just kind of want to figure out what works for you and how your body responds to it. One of the things with taking, especially herbs and things like that, is that, again, if you're taking it for 2 to 3 days and you're not seeing an increase in your milk supply, then it's probably not working. You're probably going to have to try something else, okay? So you don't want to just keep trying taking this herb for a long time and it doesn't work. Caffeine is okay to drink. It just needs to drink it moderately. And so when you think about coffee, just knowing that the caffeine does go into the breast milk. It's super important to drink lots of water. And just basic good nutrition is generally what we suggest. So eating foods that are high in protein, reducing your sugars and carbs, eating lots of fruits and vegetables, and just an overall healthy, balanced nutritional diet is best. So just so that you know, though, milk is produced by mothers regardless of their nutritional status. There are people in places where food is not as abundant as it is here in the States, and they're still produce milk. The thing about that, though, is that their babies are getting the nutrition, but mom is lacking, right? So that's why it's encouraged that you eat healthy foods and nutritional foods, because you need that for you so that both of you are able to thrive and survive. Some milk storage guidelines. You can leave it out for 3 to 4 hours at room temperature. And so that's like 72, 73 degrees in your house. You can leave it out for a few hours there. If you're going to put it in the refrigerator, it's good for 3 to 4 days. And you want to put it in the back of the refrigerator, not in the door. And it's good for 6 to 12 months in the freezer, again, in the back of the freezer. And the reason being is because the door opens and closes, so the temperature can fluctuate. So you want a steady temperature to keep your milk in. And you don't want to thaw out and refreeze the frozen milk. So once you thaw it out, you're going to need to go ahead and use that milk. As far as pumping, there are many different types of pumps that are available, and they all have different prices. Closed system pump are the recommended type. So we're talking about the double electric breast pump that you can get from your insurance, those like the Spectra or the Medela or the Even Flow, those type of pumps. Those are really good for you to use if you're going to be doing a lot of pumping, like going back to work, different things like that. There are hospital grade pumps that are ideal, and those are especially good if your baby's in the NICU or you have a premature baby, your baby's not latching, and you're needing to do a lot of extra pumping. And then they have the hands-free pumps. So those are available to you. I would definitely not encourage you to get a hands-free pump if you are wanting to do more pumping than breastfeeding, just because it's battery operated and you want something that's going to work stronger and harder for you to get the milk out. And so just be thoughtful of that. But I definitely understand the convenience of having a hands-free pump. So if you can do both, that's great. But if you can only get one, I would say go to your insurance and get a double-breasted electric pump. The parts are, most of them are washer safe. And so you can just put them in the dishwasher. You want to hand wash with dishwashing liquid and warm water, especially those small parts. And some of the pumps you may have to hand wash. A cool tip is that if you're pumping and you're pumping more than once a day, you can put those parts, the parts that touch your breast and touch the breast milk, you can put those parts in the refrigerator in a Ziploc bag and use them throughout the day because your breast milk is sterile. So it's not touching anything, it's no saliva getting in there. And so you can just put that in the refrigerator. And then at the end of the day, you wash all of the parts together with warm soap and water. And then at the end of the week, then you can sterilize it. So that's just a good tip for those who are having to do a lot of pumping, especially like going back to work. So we provided some website resources that you can check out to get more information about pumping and/or storage if you need to. So some common challenges with initiating nursing is getting the baby to latch. That's like the most common issue. And so some of the things that can hinder latching is if the baby is separated from you for a long period of time, just not having that baby right there to immediately start that process. That can take some time, especially if the baby's separated, like going to the NICU or something like that. So that can affect latching. If the baby has some kind of oral tether or tongue tie, that can make latching painful and hard. Finding the right position. A lot of times, especially for first-time moms or first-time breastfeeding moms, just being comfortable with holding the baby in these different positions. And if the baby's not in the right position, it can cause some issues with latching and just discomfort. The mom is having nipple pain or engorgement and they're not being resolved. Those things can cause some problems with latching. Other reasons that can be challenges with initiating nursing is trauma. Trauma may impact a person's desire or their experience with breastfeeding. So if you've had personal trauma, a history of trauma that comes up when the baby's coming to your breast, it can be any type of trauma, even trauma to your breast from a previous breastfeeding experience. Those things can be a challenge. Anxiety about feeling like you're failing at breastfeeding, not feeling that you have it, you're not comfortable or not producing enough milk. So those things can be challenging as well. And so a lactation consultant who takes a trauma-informed approach can help you with those things. So someone who knows about breastfeeding, knows some signs of trauma, and that you're willing to open up to, they will be able to help you with overcoming some of those challenges. So here are a few breastfeeding positions. You see my baby here. So there's a few positions that are in this picture, and they're the main positions. So we have the cradle position, which is basically where you have the baby in the same arm as you're going to breastfeed the baby with. So if you can see this picture, this is what we call a cradle position. You're using the same arm, the baby's head is facing the same breast that you're going to feed with. And this is the cradle. And then we have the cross cradle, where you're using the opposite hand to hold and support the baby's head and shoulders and neck, and you're feeding on the opposite breast of the arm. And then you have the football hold, where you're basically holding the baby like a football. And so it's going to be kind of tucked in. And you can do it where the baby's facing, tummy to your side, or if your breasts are bigger and you need to be, to see what's going on, you can have the baby laying flat on the back and kind of coming up to your breast. There's the laid back position, which is the one that we spoke about a little bit earlier when I said allowing the baby to latch naturally. It's going to allow the baby to kind of latch on its own, be able to find its way to the breast and just get there. And that's going to be a laid back position. So basically the baby's going to be at a small incline or maybe laying flat, depending on how you are situated in your bed, the couch, or wherever you decide to feed. But this allows the baby to kind of move around and get on comfortably. And then the sideline, which is also one where everybody's comfortable. Mom is able to kind of lay on the side, the baby's able to lay on its side, and you're more relaxed. Everybody's more relaxed. And you can still see what's going on, but the baby's supported, your breast is supported by the bed, and the baby's body is supported by the bed. So the last two here are some of the more natural ways to feed, but can be a little bit more difficult if you aren't comfortable with it. So we're going to watch a video, and this basically talks about sucking, latching comfortably, some positions that are good to use. So we'll go ahead and let you watch this video.